Okay, so we're looking here at the gluteus maximus, and you can see this is also gluteus maximus. We actually cut right through here, and you can see that it'll span from the sacrum and the coccyx bone, part of the ilium as well, all the way over and attach onto some of the femur, but mostly on to that IT band down here. Okay, in terms of function, the gluteus maximus will be a powerful hip extensor, so it can do extension of the thigh or trunk at the hip. It can also contribute to external rotation of the thigh at the hip and some abduction. If I reflect gluteus maximus, we can see gluteus medius right here, and that's going to span inferior to that iliac crest. So we have that iliac crest right here. Make that out. If I had kind of sitting like this, right, it'll span inferior to that, and it's going to attach onto the femur here in that greater trochanter area, which if I line this up, you can see that where that would fit. So where I'm feeling right there, we can connect that to this part here. Okay, so when it contracts, it'll pull like that, and we'll get abduction of the thigh at the hip. Okay, then next we'll move down, and I'm going to go ahead and sleep by you. I'm just going to keep that internally rotated. Okay, so next we have this big nerve, the sciatic nerve. If we follow it up, we run into this muscle right here called the piriformis. Below that, so this is number one, piriformis. Number two, we have this muscle right here. That's going to be superior gemellus. Number three is this muscle here. This is going to be obturator internus. Number four, below that, it's going to be inferior gemellus. So the way we can look at it is superior gemellus and inferior gemellus kind of sandwich that obturator internus here. All right. Below inferior gemellus, we'll have this next muscle here, which is quadratus femoris. Deep to these two muscles, we can see some of that muscle belly of obturator externus. All right, and collectively, we can see how they span all the way over to that greater trochanter of the femur. So when they contract, we'll get external rotation of the thigh at the femur. We can see that where if I go ahead and internally rotate, we can see those muscles lengthen. And then if I externally rotate, we can see they bunch up a little bit. So that kind of mimics what we would expect to see in terms of a muscle contraction. So again, internal rotation, they lengthen. External rotation, they bunch up. So they would be external. They would do external or lateral rotation of the thigh at the hip. And I skipped one muscle, making our way back up. Again, the gluteus medius here. Deep to the gluteus medius, we have gluteus minimus. And that, in terms of function, will actually get internal rotation of the thigh at the hip and can also contribute to flexion of the thigh at the hip and some abduction. All right. Next, we have the gluteal stabilizer muscles. So we can pinpoint those based off of their location to this landmark, which is going to be that sciatic nerve. So we can make out that sciatic nerve coursing all the way down. And if we follow it up, right, we can see it runs into this muscle right here, which is going to be that piriformis muscle. If I go ahead and rotate the thigh there, we can see those muscles pretty well. So we have the piriformis right here. That's number one. Number two, can make it out right here. That's going to be superior gemellus. Below that, looks a little whiter right here. We can make out some of the tendinous tissue. This is going to be obturator internus. Number four, this muscle right here is inferior gemellus. Number five, make out this rectangular flatter muscle right here. That's going to be quadratus femoris. And then deep to that, we can see, got my probe on obturator externus. All right, and moving up here, we can see that when they contract, they'll course over to the femur. They're all going to help externally, or help with lateral or external rotation of the thigh at the hip. And we can see that because if I go ahead and externally rotate, we can see that those muscles shorten. And then if I go ahead and internally rotate, we can see them lengthen there. And so that tells us that they have some action at rotating the thigh at the hip.